always like to talk, we talk a lot about the villains in society. We do that every single day. But I have a lot more fun talking about the heroes, those on the front lines. We talked a lot about Officer Shea. He's the Metro police officer that was shot in the back of the neck during the protest. And I went to one of his fundraisers, and we've talked about him and what he and his family are going through. I can't even imagine. He's a hero. Let's not forget about all the heroes that are on the front line that have been saving lives when it comes to this coronavirus, putting their own lives on the line. And the woman we have with us on the line right now is no exception to that. Her name is Susan Yowell. And Susan has spent a month or so in New York City at the height of this pandemic. She has over 40 years of nursing experience. She also was a first responder after the 9/11 Ebola and also the Ebola crisis. So she is really a hero, and it's certainly an honor to have her on the show to talk about her experiences. Susan, thank you so much for being here. How are you?
I'm doing well. Thank you for having me.
Sure, Susan. It's an honor to have you on, and there's so many questions I want to get to you here in a short period of time, but let's start out with this. What made you decide, as a 64-year-old woman living in Mesquite with plenty of nursing experience, what made you decide to go into New York City, which was really the height of the pandemic, was the scariest time in the world for you to be there? Talk to me about what made you decide to do that.
So being there during 9/11, it brought out a opportunity for me to see how New Yorkers react. And when Governor Cuomo put out the call for individuals from all over the country to be able to come and assist, there was nothing else that I could do. My husband and I made the decision for me to go in. And with the experience I have as both an adult and a pediatric intensive care unit nurse, I just felt that it was something I had to do.
Wow, really courageous of you to do that. All right, so let's go into this now. What did you see when you went in there? It's my understanding that most nurses are caring for maybe one or two patients, but my understanding is when you got in there, you were caring for 4. Is that correct?
That is correct. It was something that I hadn't expected. However, all of the staff within the hospitals throughout the entire New York area, many of my colleagues that I've spoken to, is that there was nothing else that we can do. The patients had just kept coming in and coming in. The hospital administration staff and all the support staff helped set up all of these intensive care units, and we just kept taking the patients as the phone calls came in. And I took up to 4 patients the very first day I was there, and had at first was overwhelmed to even think that was going to happen without a on-the-floor orientation, and just did what I was trained for and took care of the 4 patients. They all did survive through the night as well as I did, and continued on until New York had brought in enough nurses that we actually got down to about 2 patients apiece, as well as the patients being able to be discharged from the hospital at that time.
Wow, that is incredible. Now, during this time, how often were you being tested yourself for coronavirus?
At that particular time, when I was in New York, the testing was utilized for the patients, those of us that were already there. If there were symptoms, I had no symptoms, so I did not need to be tested.
I can't imagine, you're certainly far more brave than I, but what is going through your mind at that time? You're not able to get tested. You could be asymptomatic, as you know. You're dealing with coronavirus patients every day, hours and hours every day. You have a family. You're married. What is your husband? What are those conversations like between you and your family members? And how scared were you yourself when all is said and done and your shift is over and you're able to, go get some rest? Is that thought crossing your mind that, hey, this could be bad for me and my family?
Oh, yes. Luckily, as far as the way that I was not with my husband at the time, he stayed back in Mesquite. The rest of my family are all in different parts of the country, so those were not necessarily my concerns. I think the biggest concern I had was when I took those first 4 patients and realized that they were all younger than I was. I've never kind of looked at my age at that, up until that point, and I thought, well, this is quite interesting, but being able to take care of patients, I think, is just part of the nursing profession. It's what God put me out there for. And I just felt that I was, meant to be there and to help out. And it was an experience of a lifetime. Most of my colleagues, we talk about it. We're all in the same boat. We kind of look at it. We are more concerned about the nurses that are staying behind. We realize that our colleagues work there. That is their home. They won't be leaving after the contract's done. I'm in Southern California now working for the COVID. Our goal as those individuals that can come into these hot spots, we just feel we now have a great deal of skills to offer, and many of us are going where we're needed.
Can you tell us a little bit about the types of things that you see on a daily basis, on a regular basis, that the general public doesn't see, only those in the hospital see, and just explain to people the seriousness of coronavirus and the struggles that you see people going through on a regular basis?
So I'm going to start with the patients first. Being in an intensive care unit, the patients only get in the intensive care unit when they're extremely critical, and it's no different here for coronavirus. Our patients are on ventilators. They're on all type of support drugs in order to be able to help them with their neurological, so that when they do come out of it, that they are not going to remember this. We support the cardiovascular system, the respiratory system, the urinary system, the GS. So the whole body's taken care of. So our primary goal is to try and be able to handle each situation that comes along, because each patient's different and how this COVID is being able to affect these patients. Families, though, we talk with the families on the phone. They're overwhelmed. We try and support them as much as we can. But with the workload of taking care of that many critically ill patients, even with 2 critically ill patients, it takes up our entire shift. With the medications, the skin care, the turning, the oral care, trying to prevent any types of infections. We, unfortunately, in all the intensive care units, we're seeing a high rate of individuals that don't survive. And I think that's the hardest on those of us that are taking care of them. When there's no family around, we become their family. We take care of their emotional concerns. If we wake them up at least once a shift in order to make sure that mentally they're okay. That's what's hard on us, trying to be able to keep the support. When we do have them sedated, just being able to touch them, even with our personal protective equipment on, we try very much to touch them in a loving way so that they know that they're cared for and supported.
Oh, I can't even imagine, Susan, how hard that is. And I have to ask you, I mean, how much of an emotional toll has this taken upon you? The fact that, I can't even imagine. I mean, share that with us.
Most of us, including myself, come home and probably the first hour or 2 after a shift, sometimes we cry. Actually, a lot of times we cry. When we are on assignment, if we are stationed like we were in New York, really close together, most of us were staying in the same location, we would, just talk on the phone to each other and let them know that if we need support, we try to keep away from each other as much as possible, because just like everybody else, we wear our masks when we're outside. We wash our hands frequently. We really wanted to be able to protect each other. Emotionally, for me, I just do a lot of praying and during the shift, after the shift, before the shift, in order to be able to keep myself centered on what I'm supposed to be doing during this time.
Sure. No, that makes sense. Well, just understand, and people probably can't say this enough to you, but how much we appreciate what you and all those on the front line are doing, saving lives. You're courageous. You're a hero. And I know that people like you are very modest. You don't want to hear that, but it's true. You are truly one of the heroes in this country, in this great country. So I want to say that, and I know that there are plenty of people behind me that would say the same thing. I have to ask you this because you're the perfect person to talk about these types of issues. There are conspiracy theorists out there, Susan, and I hate to bring this up, but I have to because it angers me. I can't even imagine how much it angers you. There are people out there that say that the death rates, they're made-up death rates, and it's because the hospitals are making money. I've heard people say that this virus is a hoax. It's a Democratic hoax. There are people that are saying, don't listen to the health experts. Don't listen to the doctors. There are politicians who are saying they won't listen to Dr. Fauci anymore. You are in the front lines, literally. What would you say to those people who say that they're making up on death certificates the fact that these people are dying from the coronavirus just so hospitals can make money? What would you say to those people?
I feel sorry for all those people that really don't understand this. We had yesterday 2 family members that died on the same day, 4 hours apart, and their family couldn't see them. They will see them in whatever funeral services that they plan, but they will have left their homes and wound up in an intensive care unit and never go home. This is not a conspiracy. This is reality. In New York, because there were so many more patients, we literally saw in one ICU, and we had about 18 different designated ICUs in our area, and we saw at least 2 to 3 patients a day that died. The funeral homes and the makeshift morgues that were set up around the hospitals were enormous. The refrigeration system that they set up in order to keep the bodies until their families could make arrangements. Usually in the hospitals, we take care of the patients. Once they pass away, they go to the funeral home. But the beds, because of the number of patients coming into the hospital, into the emergency room, trying to get them into intensive care unit as soon as possible, we had to remove the bodies so that another patient could come in.
Oh, that's just, I can't imagine how hard that is on people like you. I can't. And I'm glad you're sharing these stories, though. It's horrible to hear. But let's be honest, Susan, it's important for people to hear, to know how real this is. If you're just joining us, we're speaking with Susan Yowell. She is a nurse with 40-plus years of experience. She lives right here in Mesquite, Nevada, but she decided to do what I think only a courageous, heroic person would do. She went down to New York City at the height of this pandemic, at times dealing with 4 patients at one time. Most nurses only deal with upwards of 2, and now she's in California, and she has quite a background. She helped one of the first responders after 9/11, helping people, and she also helped in the Ebola crisis. She is a hero, and she's joining us right now on the line. Susan, can you talk a little bit to us about ventilators? Because it is my understanding that if you go on a ventilator while some people are surviving and it helps people breathe, at the same time it causes also tremendous damage, and sometimes the heart just can't keep up with it. I remember hearing a story of a man in his mid-30s that was married, and they had to put him on a ventilator, no underlying health conditions. And then when they got him off the ventilator, heart couldn't keep up with what was going on, and he went into cardiac arrest, and he died. Can you talk a little bit about these ventilators? What information can you give to us about this?
Okay, so ventilators basically have 2 easy functions to think about. One is inflating the lungs, okay, and keeping them inflated. The second is moving oxygen into the blood and taking out the byproducts called CO2. So the ventilator's whole basic process is to keep the lungs functioning. There are different modes on them. The physicians order them. We work with the respiratory therapists in order to be able to, they control that particular piece of equipment. When the patients come off that do survive, yes, their lungs have been damaged. So an easy way to think about this is think about a piece of fruit. If you leave a piece of fruit out for a while, you start to see these dark spots on them. Those dark spots means that death has occurred in those cells. It's the same to the lungs. So if some of the lung tissue has been damaged that bad and they do come off the ventilator, that puts an extra stress on the heart, so that the heart now has to be able to move blood around either more quickly in order to be able to take up the oxygen for the rest of the body. And if it can't do that, then the heart, of course, is affected first, because most of the oxygen that once goes through the lungs comes out and goes into the heart and then into the rest of the body also.
Got you. Thank you for describing that to us. Obviously, it's never something you want to have to do, but in some cases, if these people can't breathe, there's no other option. There's no other choice. I want to ask you a little bit about Nevada specifically here, and I know you're in California now, and I understand you spent a lot of time in New York City saving lives down there, but now you look at your own state. Okay, Susan, you live in Mesquite, and now we're learning that Nevada currently has the highest rate of coronavirus transmission. The Strip is open for the most part. And I said months ago, I said, we better not open the Strip too soon. You know more than anybody, and you're not the only nurse or people in the front line that I've talked to, and they've all agreed with me when I said, I just don't think we should open up the Strip. I think it's too soon. Now you have, as you know, what's going on in California. A lot of stuff shut down in L.A. and then Arizona. And I think of July 4th coming up this weekend and all the people that are going to be on the Strip. And I'm very concerned. I'm very worried. What would you say about your own state, the fact that the rate of coronavirus transmission is the highest in the country right here in Nevada? What are your thoughts on that?
I think the most difficult thing, or the one that most of us nurses have thought about, it's not just that it's affecting our state, is that anybody that comes to the state of California, goes to the casinos, they go back to their own state. And because of the way this coronavirus works, is that they're taking it back to their state also. So are we really being responsible at this particular time, especially during the 4th of July, where it's already impacting all of the hospitals in direct areas where people can drive? But in our own state, it also is going to start to affect our intensive care units, because those individuals that have what we're seeing as a very rapid onset of symptoms from the coronavirus, they're going to hit our intensive care units, and they already are. And we only have so many beds like anybody else.
Of course.
Being able to see, are we going to wind up doing like New York and opening up a whole bunch of emergency room, a whole bunch of other intensive care units?
Do you think, Susan, that could happen? Do you think there is a strong possibility that Las Vegas could, in fact, look like New York City down the road?
The more it opens, the more patients that come, yes. Because it's not just people that come to Las Vegas or any other casinos here in Nevada. They come in with coronavirus. They're bringing it into our state also. Not just taking it out because they get it from whoever they're, in contact with here in Nevada.
Absolutely.
They're bringing it into our state because we're welcoming them.
Absolutely. And I could not agree with you more, and you would know more than anyone. I have to talk to you now about masks, because there are people specifically right here in Las Vegas that are opening up these protests. I will not comply with Governor Sisolak. It's happening throughout the country, by the way, where there are, for lack of a better term, dopes out there that refuse to put on a mask. You're in the front lines. If you're talking to somebody right now, and I'm not one of them, I wear a mask wherever I go, and I have no problem in doing so, what would you say to somebody out there that's a member of this, whatever you call it, protest group of not complying with wearing masks? As someone on the front lines, as you, what would you say to somebody like that who refuses to put on a mask?
That it's so hard for us in the medical profession, because we know that a mask contains the breathing that we do, whether we're breathing or talking. We are sending out the droplets that this COVID is carried on. And so we know the masks take care of it. We all wear them. We all wear them coming, going, inside, outside. We are so focused, and it is the major thing we talk about. We asked the public to please understand there's only so much we can take care of in the healthcare field. And the more that this virus continues to spread, because we won't wear masks, there's going to be a point where we're going to overwhelm this entire country. And yet we know it's something simple as washing your hands frequently and wearing a mask anytime you're in contact with anybody outside of your own immediate in-house family members.
Yeah, that's great advice. Great advice that you're giving. I have to ask you, we only have a few more minutes left to go here, Susan. I grew up about 2 hours away from New York City, so 9/11 very close to my backyard. And you were one of those heroic people that went down there to help. Can you just share with us briefly your experiences and what you remember about those days after 9/11 as one of those first responders and what you had to deal with?
I think the biggest thing that hit every single one of us that ran into New York at that time to help out was not receiving the patients. We were ready to help. It was the hardest thing after that, was not receiving the patients that we had expected. The second hardest was working right alongside of all those New Yorkers that had lost family members. We had nurses, several nurses that had lost 7, 8, and 9 family members at the same time.
Oh, my gosh.
They came to work, and all we did was support them. We made sure that the patients they were taking care of were supported. When they needed to break down, we took over their patient load. And I went back just before Thanksgiving. Many of us that went in then went back during Thanksgiving and stayed through the new year and just helped all of those individuals. We did a lot of sending nurses home so that they could be with their families during the holidays. And the hospitals there, again, New York took care of their own. They supported that entire process.
Unbelievable. Well, Susan, I know I can't say it enough, but I'm going to say it again, and everyone needs to tell you this, of what a hero you are, and so lucky to have people like you on this planet. And what you are doing, you are saving lives, putting your own health on the line, and I can just hear it in your voice how much you care about the people that you treat and the lives that you save. I can hear it in your voice how passionate you are at what you do for a living, and I just want to say thank you so much for sharing your story. I hope that you hang in there and keep up the heroic work that you are doing, and we all need to remember all this political stuff that's going on and the debates and the conspiracy theories. There are people like you out there, thousands and thousands of people like you out there across the country and across the world right now that are risking their lives, to save others. So I just want to say thank you again, Susan, for everything you do. Please be safe, you and your family, and love to have you on again at some point down the road. Thank you so much for your time. We really appreciate you, Susan. Thank you.
You're welcome. You have a great day.
You too. Wow, that is Susan Yowell, a nurse who has treated COVID patients in New York City at the height of the pandemic. She's now in California doing the exact same thing. I hate to say this, but I have a feeling she's going to have to come back here and treat people in Las Vegas and in the state of Nevada. That is a powerful interview. Don't listen to Laura Ingraham. Don't listen to Tucker Carlson when it comes to this stuff. Don't listen to those people. Heck, don't listen to me. Listen to Susan. Listen to those that are on the front lines. Listen to those that are nurses, doctors. Listen to those that are risking their lives to save others. Those are the type of people that you need to listen to. You heard it in her voice how real this virus is. You heard how upset and annoyed she got when I told her about some of these conspiracy theories that the death rates are being, made up and the hospitals are making money. She almost cried. She was crying. Stop it with that stuff. If not for me, to respect people like Susan, stop it with your ignorant conspiracy theories. I'm tired of it already. This virus is real. What more do you want to hear? And wear your damn mask and stop complaining about it.